What if I told you that right now, as you're watching this, your gut may be silently sending a flood of toxins directly into your bloodstream? And the warning signs are things most doctors completely overlook at your annual checkup. That might sound alarming, but the science behind it is absolutely real. And today, we're going to talk about it clearly, honestly, and in a way that gives you real power to act. My name is Dr. Gerenal, and for more than 27 years I've worked in integrative medicine and digestive health, helping thousands of patients, especially seniors, who came to me exhausted, foggy, inflamed, and confused about why they felt so unwell despite following their doctor's advice. What I discovered again and again was a condition known as intestinal hyperpermeability, or what many people simply call leaky gut. A growing body of research suggests that markers of intestinal permeability increase significantly with age. In simple terms, the gut lining can become weaker over time, allowing unwanted substances like undigested food particles, bacterial fragments, and toxins to pass into the bloodstream. When that happens, the immune system reacts, triggering inflammation throughout the body, and the symptoms often look exactly like normal aging: fatigue, bloating, joint pain, brain fog, skin flare-ups, low energy, memory problems. But what if many of these symptoms are not simply age, but signals from your gut asking for help? I want to hear from you. Drop your age in the comments below and tell me, have you been struggling with unexplained fatigue, bloating, joint pain, or brain fog lately? Your story may help someone else realize they're not alone. Today, I'm going to walk you through the 5 most important warning signs that your gut may be leaking toxins into your bloodstream, ranked from important to absolutely life-changing. And by the time we reach number 1, you'll understand why so many people feel like their health keeps getting worse no matter what they try. Let's begin with number 5. If you constantly feel bloated, heavy, or uncomfortable after meals, your gut may already be showing signs of distress. Inside your intestines is a thin protective lining made of tightly connected cells. These connections, known as tight junctions, act like security gates, allowing nutrients into the bloodstream while keeping harmful substances out. But stress, aging, medications, processed foods, and poor diet can weaken those gates. When that happens, toxins and bacterial fragments begin slipping through the intestinal wall, activating the immune system and creating inflammation. The result is often bloating, gas, cramping, and digestive discomfort that never seems to fully go away. Research has shown that the protective mucus layer inside the gut also becomes thinner with age, leaving the intestinal wall more vulnerable to irritation and inflammation. One of the easiest first steps you can take today is to reduce ultra-processed foods. Ingredients commonly found in packaged products, especially certain emulsifiers and additives, may damage the gut lining over time. Start reading labels. Your gut notices everything you eat. But digestive symptoms are only the beginning. Because when toxins escape the gut, they don't stay in the gut. They can affect your brain. Number 4 is brain fog and memory decline. Have you noticed that your thinking feels slower lately? That your focus isn't as sharp? That names, words, or memories don't come as quickly as they once did? Most people assume this is simply aging, but your gut and brain are deeply connected through what scientists call the gut-brain axis. Your digestive system contains millions of neurons and communicates directly with the brain through the vagus nerve. When the gut is healthy, this communication supports clarity, mood, and mental sharpness. But when inflammatory toxins from the gut enter the bloodstream, they may contribute to neuroinflammation, inflammation that affects the brain itself, and neuroinflammation often feels like brain fog. Studies have found that people with higher levels of inflammatory markers linked to gut permeability frequently perform worse on cognitive testing. In seniors, this becomes even more important because both the gut barrier and the blood-brain barrier tend to weaken with age. One simple habit that may help support both brain and gut health is adding high-quality extra virgin olive oil to your diet. Certain natural compounds in olive oil have been associated with reduced inflammation and improved gut barrier support. But brain fog is still only part of the story. Because when the immune system is constantly reacting to toxins from the gut, the inflammation spreads throughout the body. And that brings us to number 3, joint pain and chronic inflammation. If your knees, hands, hips, or shoulders ache constantly, especially without a clear injury, your gut may be playing a bigger role than you realize.